another Live Crooked Spine Show interview with Vanessa, the owner of SweatLogic in Upland, correct?
That's right.
Okay. Been here for how long now at this location?
We're coming up on 4 months.
4 months now. She's done phenomenal work. We want her to talk about how is this geriatric mom, and she doesn't look geriatric, obviously, okay, but she is at the age where most doctors say, be careful getting pregnant at that age. It's going to be very hard, difficult. Maybe even hold the baby the whole time for one also. She wants to break the myth that you can't stay active during your pregnancy at her old age, as she looks like 25 years old. At that point, let's make sure you understand how we can stay healthy during your pregnancy when you're over 30, obviously. For most people are being told very careful. Vanessa, tell me why that's a myth in your eyes, how you've helped yourself and people get healthy when they're pregnant over 30.
Well, it's a giant misconception.
Okay.
It's about how you treat your body and what lifestyle you live and your age of your body, right?
Okay.
At almost 40, I'm running circles around people that are pregnant at half my age. So
Amazing.
It's a misconception in how old you are having a baby. And clearly we have to be cautious, and clearly we have
Sure.
to make concessions and understand that there's things we can and cannot do in pregnancy as you're younger, as you're older. But generally speaking, there is absolutely nothing that I cannot do that the 20-year-old pregnant person can do.
Perfect. And when you say that, this is your, how far along are you right now?
8.5 months.
And then this is your first child or second child?
My second baby.
Second child, right? Mm-hmm. Okay. And then how did your first one go? Was that more the trial period, how things would go, being healthy and running a studio? And tell me too, what do you do here with your clients being a trainer, not just the owner of SweatLogic?
Well, the first pregnancy was probably just as easy as this pregnancy.
Yeah.
I wouldn't say that one was harder or more difficult. Generally speaking, as a trainer and as a health coach, a wellness coach, it's my job to be an example. It's my job to create inspiration and to tell people what is possible. So if I can be that person that can create that spark of intentionality or this connection to your body, and I teach you that, like, yeah, you can do it, and the reality is that there's a safe way to do things in almost every situation.
Good.
If you have issues like with medical issues, you have some spinal issues, right? I'm sure you have lots of those clients. Generally, we need to be cautious, but that doesn't mean it's impossible, right? We can create new versions of what we used to do before. We call it modifications, right?
Yeah, modifications.
We want these modifications for people in whatever circumstance they're in. So pregnancy, yes, is a modification, and it's temporary, because pregnancy is temporary.
Like it's 12 months, 13 months, I'm sure it was.
Yeah, that'd be,
9-ish.
that's about 10.
10-ish,
Depends.
maybe.
My daughter was very overdue, so closer to 11. But generally, it's not forever. And you can go back to your rock climbing, you can go back to your extreme cycling, you can go back to your trail running, you can go back to all those things after you have your baby.
Yes.
If you're strong enough, right? And you can do that faster if you've trained your body to be comfortable, confidently, like connected in your being while you are pregnant. So this time frame is not like, oh, let's take 9 months to just enjoy and relax.
Yep.
It's actually, let's take these 9 months to connect deeper, to create more space in you to know, hey, yeah, my abs might be floating over here somewhere, but they still work. And maybe you learn something different about how they work.
And take me back to, what do most people that go see their medical doctor, what's the stereotypical conversation with their doctor? Hey, I'm over 30, I'm pregnant, what should I do, what should I not do? What is that conversation normally like?
There's a lot of cannots.
Okay.
There's a lot of, you can't do this and you can't do that, and you stay away from this and stay away from that. And yes, within reason, like you have to clearly not, go skydiving when you're pregnant. Yeah. But the reality is that
liability thing, you're like, oh, you did what? What? No, you're out of here.
Yeah, no thanks. But can you do all the things that you did before? Absolutely.
Good.
Can you do them the same way? Maybe not. Right? Like maybe you have to just have a little concession time and realize, okay, perhaps I need to step it down a notch, or perhaps I need to take a little longer to do the same sets. Good. Perhaps I get to just, instead of working out 7 days a week, I'm pushing to 5 days a week. And as the pregnancy progresses, perhaps you just are lighter and lighter with what it is that you do.
Is that a feeling though? Is that a feeling? How do you get that feeling of where my limitations should be for my own personal self?
I think it's your connection.
Okay.
Your connection to your body.
Good.
And you realizing, oh, you know, this exercise is taking 2-3 times more energy than it used to.
Got it.
But you're also carrying extra weight. You're also utilizing a lot of extra hormones in your body that you're not used to when you're not pregnant. So
Good.
there's going to be a shift. There's going to be a change, and you're likely going to be tired. Like, that's the reality of pregnancy. So if we can challenge ourselves to do what we can in the times that we feel good, that's going to help long term. Because the more healthy I am in my pregnancy leading up to my delivery, the faster I'll recover after my delivery.
Huge.
My C-section was a breeze. Like, and I know that's hard to believe, but I felt like I healed so spectacularly fast.
That's it.
2 weeks, and I was back to my normal routine.
Wow.
Not trying to recommend that or suggest that, but generally
not everybody.
speaking,
Yeah.
it wasn't that hard. Like, everybody told me it's going to be really difficult.
Yeah.
I didn't have that experience.
It's almost like and going back to it too, feel like, well, Vanessa, you're different than I am. What qualifications would you say if you interview someone who is pregnant, like you had mentioned one of your clients now here? When you interview them, how do you, I guess, get them started on working out if they were working out before, but also continue working out on parameters like in modification? How do you usually go through that with your clients?
Well, the first thing I tell people is listen to how you feel.
Good.
Right?
Okay.
If you are too exhausted, if you're too tired, if you're finding that you're relaxing in your body, the hormones in your body are taking over, then that's a conversation we need to have, and we need to bring it back up into the conversation. Generally, our bodies change so much during pregnancy that it's really hard to just say, oh, you're going to fit into this box or this box. There's a lot of options.
That's health. That's medicine. That's medicine healthcare. That's don't worry about diet. It's almost like, but you take it on a personal level. What's your lifestyle like? Mm-hmm. What are you eating? How much do you sleep? You almost go through the whole process of someone's lifestyle, not just what they're feeling or their symptoms, or that they're just pregnant.
Yeah, well, you need all of it.
Yes.
That's the only way you're going to be successful. You can't just, expect to not sleep and have a happy pregnancy. You can't just eat the worst things in the world and then feel wonderful. You got to remember, you are providing a space for not only your changing self, but also a growing person inside of your body. So being mindful of how many calories you're ingesting, being mindful of what types of food that you're putting into your body, how much movement you're putting in, and generally, how much of the holistic health care that you choose to do outside of your fitness regimen. For example, getting your chiropractic support, right? Going into some red light therapy, perhaps doing some cold plunging, which you can do when you're pregnant.
Good.
They do ask you to stay away from extreme heat, and when I say extreme heat, it's extreme heat.
Yeah.
Like not getting into 120, 130 degree room, but is it 105 degrees in July here in the summer? Yes. Can you be in 105 degrees while you're pregnant? Yes. Can you work out in 105 degrees? Yes. As long as everything else is under control. So
you should be watching your body. You should be mindful of what you're feeling. Did you hydrate that day? Did you have a good night? Whatever. Like anyone would. You're still human. Just you have a little baby inside of you growing.
Right. You just have to be more mindful. And that's all. It's just being cautious, but also giving yourself that permission to keep being who you are.
Good.
There's nothing that says that you cannot X, Y, or Z except for you. Now, clearly, precautions are there for a reason. Please listen to your healthcare provider. If they tell you there's something wrong with your blood pressure, or you have issues with gestational diabetes, or you have some other issues that perhaps are giving you a slightly different style pregnancy, then you have to listen to those problems. However, if you have a smooth sailing, easygoing, geriatric old pregnancy, there's no reason you can't do 90% of all the things that you were able to do before.
You're almost giving some permission to go, you're still you. So at that point, if you were this person beforehand, let's maintain that person, but maybe modification based on what else is going on, but never stop being you just because, not just because you're pregnant, because you have someone else growing inside you doesn't mean you can change your lifestyle.
Right.
Huge.
Right, and you shouldn't. Like, and that's, you know, the idea of not moving is scarier than the idea of continuing to move. People ask me all the time, how are you still working out? How are you still teaching?
Yeah.
Well, to be honest, if I don't, I feel worse.
That's great. That's when I say great, because if you don't move, you're supposed to be moving, body goes, what are you doing to me? Now you become more stiff, nerves shut down, you feel more stressed, you sleep worse, you want to eat crappy food because it makes you feel better for that short period of time, and you start having a bad attitude. Mm-hmm. And does that affect your baby also when you do go through those negative changes?
Oh, absolutely.
100%.
Yeah. If you're depressed, if you're unhappy, if you're anxious, your baby's going to feel those things. Mm-hmm. So if taking that walk or going on that run is going to, in that moment maybe not be so fun in the sense of, you know, it's work. You have to work toward your fitness and you have to work toward your exercise. But the after effect, that's what's going to give you the positive momentum to go into the next day and into the next day. So sometimes that first day is rough.
You're talking about what you're explaining right now, someone who just is working out.
Well, yeah.
Being pregnant. But I think the other symptoms people experience, for example, my patients that are pregnant that go through my care, I always tell them, if you're stressed, the baby's stressed. Mm-hmm. The nerves affect both of you. So can you keep your body less stressed by moving, eating well, drinking enough water, maintaining a good mindset, everything you do? At that point, their body can be less stressed, so the baby's not stressed, so you have an easier pregnancy, I'm assuming.
Oh, absolutely. Yeah, assuming that you don't have any type of
health issues, medical issues.
Right,
for one,
but
too.
yeah, absolutely. Like it's very clear, even at this stage right now. Like if I'm in a happy mood, it feels like he's in a happy mood. So
connected. And you're 12 months pregnant. You said how much right now?
Okay. 8.5.
8.5. But at that point, you've gone through this second time too. How do you, when you work with a client for one also, how do you get their mindset if they are somewhat, if you want to call it anxious or a precautionary to an overextent, how do you get them to change their mindset to where it's okay to maintain that lifestyle?
Just telling them.
What you went through.
Yeah, just giving them the example of as long as you're cautious and as long as you're connected, everything will work the way it's supposed to. Yeah. And what I mean by the way it's supposed to is your body will tell you if there's something going on.
Yes.
Your body's feedback is one of the strongest senses that I think you can learn, not only non-pregnant, but even more so pregnant. So the feedback, oh, my back is hurting, or my hip is hurting, or my shoulder is doing this, or whatever it may be, that's feedback. That's for you to go, if you don't know how to take care of that, find a professional, very different modalities, but find a professional that can help you and let you know, like, oh, let's get that adjusted. Or if I have clients come to me and they tell me things that I cannot help them with, I am going to refer them to a different holistic professional that does know what they're doing to support them. Just having that circle or having that connection to say, hey, you know what, it might be a good day for you to go see Dr. Tony is huge, because maybe you don't know where to go. Maybe you don't know who to speak to. Maybe you don't know that there's actually somebody who's trained and understands the pregnant body the way that you need them to be supportive for you. Just because you're a doctor or chiropractor doesn't necessarily mean that you have all the skills you need. Sometimes we need to find the people who really do know what's up.
Well, I've experienced too. I think there's a couple doctors in the area that are very good at pediatric, even mom care too. But it's having doctors that are confident enough to help you versus, oh, I'd be careful, you're pregnant, I can't touch you, blah, blah, blah. I've had people come to me going, I've talked to 3 doctors, chiropractors in the area, they won't see me. Will you see me? I'm like, of course I will. I've adjusted. I was telling you, my friend, they had their baby the next day when they adjusted her. I had the same thing, a mom come in and she was due. I adjusted her that Saturday or that Friday. She had her baby on Sunday. But it's something to where when you're confident what you do, the spine is the spine, and we can treat the spine around the baby to help the mom feel better. So neurologically, the body calms down. Then the birth canal opens up, the body relaxes, like your bladder, Once you're under stress, everything contracts. You get the body to relax, and now you can get to a healthier state naturally by itself. I think that's the plan.
And that's huge.
And what do you teach here to help moms, or even just in general, that would help moms to feel better mentally, physically, and everything else?
Well, a lot of people have this misconception that Pilates is like a boot camp or like a cardio workout.
It's dangerous.
It is very difficult if you're doing it right. And in our studio, we take a lot of time to actually slow down.
Good.
We want to slow down because we want the form to be the most important thing that we do here. Form is everything. I would rather you pick up a 2-pound weight than a 10-pound weight and do things the right way, and then learn to progress over time and create that. So it's about reminding ourselves that that connection to being, that connection to your center, your spine, right, is truly one of the best opportunities you can create strength inside of your body. And if you can create a healthy spine, a healthy set of abdominals to help protect your back, all of, for pregnant, not pregnant, like
anybody,
you will benefit substantially. So it's about sometimes slowing down and reminding yourself, let me do this the right way. Let me challenge myself to connect to my breath, connect to my center, connect to this ability to hone in on what it feels to really engage.
Good.
Rather than just moving around.
And you're gonna, and I would assume by doing that, using form and focusing on really how things happen, you're gonna help prevent injury that way. For someone who's just trying it out on their own, watching a YouTube video.
Oh, absolutely. And having a professional watching.
Yes.
Right? Because there's a huge difference between you doing an exercise in your bedroom and pushing into an exercise you're not ready to go into, and then somebody who knows what they're doing can say, hey, let's step your feet back another 3 inches. Let's shift your body forward a couple extra inches. Those are things that you're not going to see because your eye isn't trained to see those things.
No.
Your goal is to find somebody who's going to not only give you that direction, but also give it to you in a way where you feel empowered.
Good.
The reality is that nobody ever does anything wrong. We're just trying to challenge you to do things better.
Good. And I like to, when you have a coach in general, you're giving them the freedom to go, hey, look, I need help with what's going on in my body. At that point, help me get there. You're cutting out the middleman of trial and error, preventing injury that way, preventing long-term and short-term issues that may give you, not only if pregnant or not, just the downside of not wanting to do it again. And if you're pregnant, obviously you want your body to be healthy the whole time. This is, you have a small window of, say, 9 months, for example, to get it there and keep it there. So even afterwards, you have the benefit of going right back to where you were before, so you can stay active the whole time. I think that's the plan.
That's the idea.
Good, good, good. How do you help them with their nutrition?
Well, generally speaking, nutrition is probably step 2 in any type of fitness journey. And it's something that everybody needs. Whether you're pregnant, you're not pregnant, you're trying to lose weight, you're trying to gain weight, everybody needs to be focused on nutrition. We always suggest that you find a nice, healthy, balanced nutrition. I would much rather you have a nice 80% rule of doing well throughout the week than you having a Monday that's like all salads and protein, then Tuesday you have all donuts, right? So
that's
it's
mine.
about
That's mine. Cut that out for the donut salads. Never mind.
But it's about consistency, right? Like, you don't need to be perfect, and in your pregnancy, you most definitely aren't going to want to be perfect because the cravings, they might overrun what you feel like you want to eat. But the reality is about it's being consistent, and if you can be consistent most of the time. Now, if you really want to make some huge changes, that's when you would consult somebody like a nutritionist or a dietitian, a different type of professional that's going to help you in that particular journey. We can always support and give you recommendations here, but generally speaking, these people, that's what they study, that's what they know, and they're going to help you create something for what you enjoy and what you like, so that way it becomes a lifestyle and not just, oh, I'll do this diet on Mondays and be done. Doesn't really quite work that way.
And not that you want to, it's like, for example, you want to lose weight when you're pregnant, but can you eat healthy so you have the energy level, correct?
Oh, absolutely.
Good.
Yeah. 8.5 months pregnant, I've gained 11 pounds. So generally, you don't have to go through these guidelines of you have to gain X amount of weight.
Good.
The reality is that as long as you have enough nutrition to support you, to support this growing child, and have the energy to keep doing what you're doing, there's no special number. It's how you feel and how you can allow yourself to thrive. And if that means that you gain just a few pounds, let that be. If that means that you gain 40, 50 pounds because that's what made you feel good, that's going to be your pregnancy and your journey. The reality is that all of us are going to do things differently, but you have to listen. And if you can't listen, then maybe just take a little time to slow down.
Huge. And listen to the right people too, correct?
What?
Listen to the right people.
Oh yeah.
Yeah.
Absolutely.
And when you have good nutrition, how does it affect your mood?
Oh, well, I mean, hangry, right? If we're hangry, things don't do well. If you're hangry when you're pregnant, then run.
Yeah.
Run away from those people.
If you're the husband, just get moved.
Yes.
The couch. The couch will be your best friend.
But yes, you want to make sure that you're not only giving yourself enough nutrition, you don't want to starve your baby. Like you said earlier, what you feel, the baby feels.
Good.
If you're hungry, your baby's going to be hungry. So you want to make sure that there's enough capacity for both of you to thrive and for both of you to feel satisfied as well.
Huge. And going through past, say, delivery, a lot of people experience, my patients, for example, a lot of postpartum depression, anxiety, or just a feeling of not uselessness, but just not there like they were before. How do you help your clients get through some of that?
Movement.
Huge.
Movement.
Doesn't stop.
It doesn't stop. Now, you have to be extra cautious. I had a cesarean, and for the first 2 weeks, it was very mindful movements, very mindful connection to my pelvis, very mindful understanding that, you just had a major abdominal surgery, and that you get to be very cautious around what you can and cannot do with your body, right? And the reality is that staying still doesn't help anything.
No.
So if you can still move, take a walk, push a stroller, just give yourself a little moment. Going outside is such a beautiful thing for your body. We are meant to have that vitamin D. We're meant to be moving and breathing the fresh air that's outside. So if you can just make it as simple as possible and just keep moving. Also, I found that doing a lot of the yoga cat-cows
Got it. Okay.
on hands and knees was super helpful to keep my spine warm, to keep my spine in this motion that it would still continue to work, especially while breastfeeding. And you're learning how to, especially your first baby, you're learning how to put your body in a certain way in order for you to feed. Even if you're just bottle feeding, I mean, it does take some practice to understand how your spine, if you're stuck in one direction and you continue to move in this direction and you don't have that extra movement and mobility built into the rest of your day, well, what's going to happen is you're going to be stuck in that direction. You're going to be calling for Dr. Tony to come to your house and help fix you.
Job security, people. Job security.
So
I mean, even dads do the same thing. They come in. Dad, Abraham, real nice guy, named his son Anthony after me. Which I thank you to Abraham. But a lot of days he's like this all day. So, like you had mentioned, how would you feed a baby after they're born to help your spine? How would you do it?
Generally speaking, you want to bring the baby up to you.
Got it.
Right?
Okay,
So if you're
up here.
breastfeeding, you want to bring it up. So the pillows, you don't necessarily have to hold the weight of your baby, right?
Yes.
We're not
Take
trying to
a pillow.
Yeah, but take a pillow, prop it up, put your baby on top of the pillow, so that way you have this capacity to bring it up, because the spine should stay nice and tall. I'm not a chiropractor, but I will tell you,
she's pretty
the
good though. She knows
spine,
stuff.
needs to stay nice and tall. Now, once you're done feeding, as soon as the baby's asleep, or perhaps into our little break that you have when the baby's not necessarily needing to feed, move your body, because the reality is that movement is going to create that breakup of the scar tissue. It's going to help create a little bit more room for your muscles to find more mobility. But more than anything, you're not going to build up that lactic acid, all those hormones that are in your body that are just going to kind of weave themselves in and then get you stuck. And then you will definitely need to go see your chiropractor.
Which is fine. If you want to see me, it's fine. But you want to make sure that your body, like she said, when you move, your hormones actually get more balanced. You're less stressed also. Obviously, when you have a new baby, like my patient Abraham, you're going to sleep less. You're going to be sleep deprived. How do you help someone get through that portion of that stress of being in not getting enough sleep?
Well, sleep is individual. Every person has their connection to sleep, so it's if I told you, okay, just go take a pill and sleep, or go down and find something to allow you to sleep, you can give me whatever look you want, because the reality is we all have our own definition of how it is to sleep and how we choose to sleep.
Unique.
You just at least have to try. You have to try to get as much rest in, even if you're not physically sleeping. Resting is still incredibly helpful. So try not to discount resting. Allowing yourself just to lay on the couch, or maybe you can pick up a book or watch a show, something that allows your body to be calm and ease, even if you can't actually physically go to sleep. But anytime the baby sleeps, you should sleep.
Take your time. And wrapping things up, what do you want moms to know as a takeaway to get started, if anything, to stay healthy during the pregnancy?
Move. Move. And try your best not to allow other people's judgments of what you are going through affect you. You know, at almost 40, I have found that I have more energy and more compassion and more connection than I would have when I was 20. I look at photos from 20 years ago and I sit there and I'm like, oh my God, I had no idea what I was doing, right? And this is wisdom, and this is just learning over the years and trying to figure out how to support other people too. But if you can't create that connection to yourself, how are you going to be a mom? How are you going to be a provider for this little human that needs you 24 hours a day? So take care of yourself first. Make sure that you are filled, you are creating what you need, and then you can pour onto those around you, your other children, this new baby, perhaps your partner, and generally allowing yourself to know that, hey, I'm whole and I'm good. I know that loss of identity is real when you become a new mom or a recurring mom, but if you can work on you and finding that peace within yourself and feeling good for yourself, then everything else will be better.
It's almost like, and for me to wrap it up, you almost got to go, okay, thanks for the advice, appreciate it. Now what I'm going to do is to rest for me, listen to my coach, my trainer, my chiropractor, whatever it is too, to help me get through this, so I can keep my body and mind healthy, again, through emotion, through nutrition, through anything that's going to help my body as I would even before pregnancy, even afterwards, so I can live a normal, healthy life for myself and for my family.
Yeah, I tell my clients all the time, pregnant or not, I don't take your body home. Dr. Tony doesn't take your body home. The person next to you doesn't take your body home. You do. So it's your job to take care of yourself, to listen to what it is that you need, and to make the most out of the suggestions that us professionals give you. Remember, they're just suggestions. Suggestions
from me based on my experience, and personal experience from Miss Vanessa. All right. If you're in Upland or near Upland, California, at that point, see Vanessa for a consult. Go to her classes. She's phenomenal. She basically brings around her own clients that are younger, that are not pregnant. So if someone can do that who's 12 months pregnant, at that point you can do it too. All right. Quick smile for the thumbnail. And Angela, Mom, Richard, thanks for watching the live. I'll see you guys soon. Have a good day. All right. How's that?
Fantastic.